Hello, my name is Cameron Ward, and I will be talking about increasing diversity in STEM fields through HPREP. According to the Texas Health Maps website, there is an over 15-year difference in life expectancy between Dallas's Highland Park neighborhood, which is predominantly white, and the South Dallas neighborhood, which is predominantly Black, even though they're only 3 miles apart. Though the factors affecting this difference are complex, one aspect that comes into play is the lack of minority physicians treating this underserved population. One study published in the Journal of Internal Medicine regarding the impact of physicians' race on patient decision making found that Black patients viewed Black doctors positively and were more receptive to recommendations compared to white doctors. Therefore, an increase in minority doctors could potentially improve health outcomes in minority patients. UT Southwestern's Office of Diversity and Inclusion has worked to improve health disparities in Dallas through the Health Professions Recruitment and Exposure Program, otherwise known as HPREP. Over the course of 5 Saturdays, Dallas area high school students are introduced to healthcare fields. Each session has its own theme, including College Day, where there's a college and career fair, medical, science, and health and wellness days featuring various workshops, and Professionals Day, where students get to mingle with working professionals. Each year, 180 high school students participate, and over 70 UT Southwestern students from the graduate school, medical school, and School of Health Professions volunteer as workshop leaders or small group mentors. Mentor curriculum consists of disseminating study skills, practicing time management, networking, resume writing, and more. Groups are paired with the same mentors throughout the program in order to potentiate the mentorship relationship. This year, HPREP was shortened to 2 sessions, done completely online due to the COVID-19 pandemic. Now I will share the outcomes of HPREP from January 2020, as this year's results are still being collected. Medical Day was the most well-rated day, with 4 of the 5 workshops receiving over 90% approval. Suture training, cow-eye dissection, dental mold casting, and demonstrations in the anatomy lab were among the favorite workshops of the entire program. Science Day workshops were also well received. The Genetics and Inheritance workshop, in which students used phenolphthaleurea paper tasting to demonstrate heritable traits, received over 90% approval. Health and wellness workshops centered on non-science related topics that HPREP leaders felt were important for high school students to know included healthy relationship building, emotional intelligence, and others. 88 students responded to the end of program survey. All students surveyed said the program was a great experience and solidified their interest in medicine or science. The vast majority of participants said that their expectations for learning and exploration were met, that the colleges and career fair showed them a variety of options for schools, and that they enjoyed their mentor sessions. Survey respondents often cited their mentor's ability to give school and career-related advice, ability to answer questions, and long-term commitment to consultation as reasons for high approval. Workshops that were interactive were highly favored, as well as those that provided the opportunity to make connections with professionals. Many students enjoyed getting to experience things that they felt were limited to the medical or graduate school setting. Students were not as satisfied with the activities that were too simple for their knowledge level or did not have hands-on component. So, if you are interested in creating your own HPREP, use the following tips. Provide participants with hands-on activities to keep their interest. Give them workshops that will challenge their knowledge and help them feel that they have learned something. And connect them with both students and professionals in their area of interest. Student participants also suggested including workshops on CPR training and taking vitals, increasing the length of the program, and delving more into the specific specialties within medicine. In conclusion, HPREP is a good example of how medical centers in urban areas can increase the diversity of medical professionals, and in doing so, improve the health of underserved communities. HPREP worked to improve the visibility of URM medical professionals because you can't be what you can't see. Clearly, representation matters. HPREP connected high school students with UT Southwestern students and professionals who they can look to for advice and guidance in years to come. And most importantly, HPREP increased the likelihood that Dallas area URMs would seek careers in healthcare in the hopes that they return as professionals with the gumption to enact positive change. Thank you.